Hello, my name is Jack Wagner. I'm with Microscientific Industries. We produce a number of chemical disinfectant products that are used in the hospital, healthcare, and the dental industries, and other healthcare industries used to contain and control infectious microorganisms, primarily on environmental surfaces. The product that I'm going to describe to you now is our Opticide 3 disinfectant cleaner, which is our newer generation disinfectant that has a 3-minute contact time. To use the product is very simple. To use the product as a surface cleaner disinfectant, you actually have two choices. You can use the product as a spray disinfectant by simply spraying down surfaces, getting the surface nice and wet, taking a clean towel or rag, and simply wiping the surface off to remove any visible debris or bodily fluids. The way that we recommend that the product be used is that you would spray the surface, allow it to sit for about 15 seconds, allowing it enough time to penetrate through blood and protein, break it down so that it can be easily wiped off the surface. The next step then is to simply spray the surface, get it good and wet, and allow the surface to remain wet for a 3-minute contact time. The advantage of the 3-minute contact time as opposed to some of the other products that are on the market is that it cuts your contact or waiting time down to about 1/3 of the normal waiting time. Most disinfectants, if you read the instructions, it requires a 10-minute contact time before wiping off the surface. At the conclusion of the 3 minutes, you just simply take and wipe the surface off again, removing the chemical and theoretically removing the dead carcasses that are present on the surface, because theoretically you've just killed millions and millions of organisms that are infectious causing organisms. To use the product with the wipe, it's the same procedure. You simply, instead of spraying the surface, you would take a fresh wipe, wipe off the surface to pre-clean, dispose of the dirty wipe, remove a second wipe, apply it to the surface, wiping down the surface thoroughly and allowing the surface to remain wet for about 3 minutes. Now, in some instances, this may require the use of an additional wipe if the surface begins to dry prematurely, particularly in those areas where you have very dry climates. In that case, because you want to keep the surface wet for the required 3-minute contact time. At the end of the 3-minute contact time, the surface will dry very quickly, and you're then free to go ahead and use the surface for the next patient. It's just that simple.